Hello, I'm Dr. Mike Amendolara. You can call me Dr. Mike, everyone else does. Anyway, I'm continuing my series of brief videos on chronic physical and emotional pain, and today we're going to focus more on chronic physical pain, specifically things like chronic low back pain, chronic neck pain, chronic whiplash, chronic tendonitis, fibromyalgia, chronic headaches, and I have a specific question I'm going to pose today. And that question is, suppose you've tried many treatments for chronic physical pain. Why have they not worked for you? Let me give you an example. When I was doing general family medicine, I would very often see a patient for chronic low back pain. And this was a frustrating experience for the patient and also for me. I knew how to do everything that I was taught to do in medical school and residency to help this person. However, with chronic low back pain and other types of chronic physical pain, the things I was taught to do hardly ever worked. So I would have a patient come to me for chronic low back pain, and I would try them on an anti-inflammatory medicine and a muscle relaxant. See them back in a week. Helped a little bit, but not much. So then I would send them to physical therapy. See him back in a few weeks, same story. Helps a little bit, but not a whole lot. So then at some point I would order an x-ray, and if this didn't show anything much, I would order an MRI, and if that showed a bulging disc or a herniated disc or some spinal stenosis, and they still were having pain and it wasn't going away, then I would refer them to a pain management specialist. Typically they would have anywhere from 1 to 3 cortisone injections, epidural injections, very close to the nerves of the spine. And very often they would have some improvement, but it would be partial improvement and it wouldn't last that long. And a lot of times they had good improvement from the first injection and that wore off after a month. And then they came in, they saw the specialist for another injection, and then it didn't work nearly as well the second time. The bottom line is they were having lots of types of treatment. They were having medicines, they were having physical therapy, they were seeing a pain management specialist for injections. These same patients also I often referred for chiropractics and even acupuncture. Same story. They had some improvement, not a lot, and the improvement usually didn't last for very long. So what is the answer? Well, specifically for today's video, the question is, why did these treatments not work? And the answer is, it's basically for most types of chronic physical pain. I'm guessing here, but maybe 95% of cases of chronic physical pain, the true cause of the pain is not physical. It's not something structural or physically wrong with the body. It's actually emotional. It's stress, tension, and buried emotions which lead to changes in the brain, the way it's functioning, and that leads to physical changes in the body, which leads to physical pain. And what all those other types of treatments were trying to do was they were trying to treat the physical symptoms and the assumed physical abnormalities like a herniated disc or a bulging disc, and only resulted in partial improvement and or temporary improvement because they were not treating the root source of the pain. In most cases of physical pain, the root source of the pain is emotional. It's stress, tension, and chronic, buried, unresolved, negative or uncomfortable emotions. Now, there are definitely exceptions to this. Cancer pain is caused by real physical structural abnormalities. The pain of rheumatoid arthritis is caused by joint erosions and damage. Same thing with the case of lupus and other autoimmune disorders. They cause problems localized in the joints that cause pain. But these are exceptions to the rule. The large percentage, or I should say the large majority of chronic physical pain that we see starts with emotions. And this is why all those physical treatments that you've tried have not solved your problem, because they can't solve the problem because they're not treating the root cause. They're not dealing with the emotional cause of the pain. But there's good news. There's really good news, because when your pain is caused by emotions, it's really easy and really fast to eliminate the pain completely and permanently as long as you know how to do it. And that's what I teach people. I teach people how to eliminate their chronic physical pain by understanding the connection between the emotions and the physical body and learning how to reverse that connection. Once you know how to do it, most people in chronic physical pain from emotions are able to eliminate their pain completely in about 1 to 4 weeks. So you could be having physical pain for 50 years. There are some people who've come to our program with 50 years worth of physical pain. It turns out it was from emotions, and the pain was gone in 3 weeks or less. So excellent news, and we'll be speaking more about that in future videos.